In this video, we'll be discussing the Developer Provocative Questions Conference, held as part of the Prostate Cancer Active Surveillance Research Initiative, or PCASRI. This conference was held on December 13th and 16th as a virtual conference in 2021. So the immediate goals of this initiative are to organize a diverse but highly interested group of patients, spouses, partners, and other caregivers, patient support network providers, researchers, and physicians to identify and address through patient-centered outcomes research projects the shortcomings in knowledge and the shortcomings in guidance regarding the decisional dilemmas faced by men considering treatment options for low-risk prostate cancer. The people who came together for this conference, which was held on December 13th to 16th, are patients, clinicians, researchers, advocates, family, and friends of patients. This conference was co-sponsored by the American Urologic Association, ANCAN, ASPE, Prostate Cancer International, Prostate Cancer Research Institute, Zero End of Prostate Cancer, and the Focal Therapy Society. We came together to discuss and collectively guide the future of research regarding the use of active surveillance in the management of prostate cancer. We ultimately generated a list of 8 priority questions that the group felt, if answered, would advance the current practice of active surveillance for prostate cancer. And so, without further ado, these were the 8 top questions that ended up coming out of this conference. Number 8. The group felt that in men with intermediate risk prostate cancer, is a high intensity interval training exercise regimen comparable to a summary handout of general exercise recommendations with regards to outcomes of grade progression of prostate cancer? The number 7 question, in men with prostate cancer appropriate for active surveillance, is consultation through a multidisciplinary specialist clinic equivalent to a single specialist visit augmented with a second opinion from a health educator for the outcome of choosing active surveillance and staying on active surveillance? Number 6, for this question, we wanted to integrate questions about genomics and MRI. And so the question was, in men with prostate cancer appropriate for active surveillance, are the strategies of initial characterization with additional genomic testing versus additional MRI with MRI targeted biopsy or fusion biopsy, or both genomic testing and MRI with fusion biopsy equivalent to each other for the outcome of tumor progression and patient anxiety, safety, and adherence for active surveillance? Number 5, in men undergoing active surveillance for prostate cancer, is MRI monitoring with this new technology, micro-ultrasound directed prostate biopsy, equivalent to the more established MRI monitoring with MR ultrasound fusion directed biopsy for the outcome of adverse pathology at the time of progression? Number 4. For this question, we were hoping to address some of the issues with disparities in prostate cancer. And so in Black men diagnosed with prostate cancer appropriate for active surveillance is supplemental education with an in-person support group equivalent to support with a telemedicine support group for the outcome of choosing active surveillance and staying on active surveillance? Number 3, in men with prostate cancer on active surveillance is a lower follow-up intensity active surveillance strategy equivalent to a standard follow-up intensity active surveillance strategy for cancer progression related outcomes? Number 2, in men with biopsy confirmed favorable intermediate risk prostate cancer, is focal therapy of the visible tumor lesion with continued active surveillance thereafter comparable to performing active surveillance alone without any focal therapy with regards to outcomes of ultimately developing the more aggressive unfavorable intermediate risk prostate cancer? And the number 1 question that was derived from the project, in men with prostate cancer on active surveillance, is a MRI-based surveillance plan equivalent to the current standard practice, which is a more frequent prostate biopsy-centric plan for the outcomes of cancer progression related and patient-reported outcomes such as anxiety? And so those are the 8 questions that came out of this initiative. What we showed, at least fundamentally, is that substantial collaboration with patients and advocacy groups can provide meaningful direction to guide future academic research endeavors. And so now what we're doing is we're continuing to analyze and further prioritize research priorities to develop a plan on collaborative studies that can be performed on these top priority questions. We want to build groups of collaborators that represent diverse practices and patient populations. If you find this work interesting and would be interested in joining the PCASRI initiative, please reach out to us. Our email is info@pcasri.org. We appreciate your attention.